Hi, everybody. I'm Dr. Navya from Sasha Lux Dermatology and Cosmetic Surgery Center, Hyderabad. So, today I'm here to talk about infant and skincare. So, let's start with the winter skincare because right now we are winters. And the most common, the problems that as a parent myself, I have a 2-year-old son. The most common problem is that I see my son's skin becoming dry. So whenever and also it starts off with he has chapped lips nowadays and his cheeks become red and cracked. So these are the few most common problems that we see. So what are the problems that we see from starting is dry, flaky skin, red, chapped lips, eczema. If your kid is prone to atopic dermatitis or anything, you'll see that now it is the time that the recurrence or it's more aggravated during winters. And most of the kids, for infants, they have they drool, they have running noses. All these can also cause dryness and the flakiness. So, and the another more common thing is the diaper rash right now, because all of us have shifted to diapers and we keep them constantly there. So these are the few problems, and mosquito bites, of course. This is the season where we see a lot of mosquitoes, especially in dawn and dusk. There's so many mosquitoes. So I'll address each of these conditions. So first, for dry and flaky skin, the thing we do is every day morning. Right now, because it's winter, I would prefer a coconut oil, and if it's summer, then I would prefer an almond oil. So apply coconut oil every day in the morning before a bath. Leave it on for 15 minutes on the skin, and always give a quick, short, lukewarm water bath. Don't give prolonged bath or don't use very hot water or cold water. Lukewarm, quick baths is what is recommended. And the next thing is, after the baby comes out, make sure the baby skin is still a little wet, damp. Don't completely clean dry the baby. Keep a little bit of water, damp skin. I would prefer a moisturizer, which is rich in ceramides, so that it helps in repairing the barrier function. And so after you apply a good amount of moisturizer, then I would prefer something, a full clothes, like a full sleeves, fully covered clothes, because as it's winter and a child's skin is very thin. So it's very prone to the temperature changes. So clothes covering the baby fully. And the next part is coming to the common cold or drooling and licking and all. It's always good to apply a lip balm to the baby also. Like I use Sebamed lip balm for my baby, so that the lips are always hydrated and the chapping can be taken care of. And the next thing, before using a diaper, now after you make when you're dressing up your baby, the next thing you do is obviously make him wear a diaper. So when you're using a diaper, I would always use a zinc oxide daily defense, zinc oxide like Desitin or Aquaphor, which ranges between 13 to 15% of zinc oxide every day as soon as the bath is done, and then make him wear a diaper. So, and the diaper that I make him wear is also preferably something which has an indicator on it. Like one of the examples is Pampers Premium, which I use for my son since he was born, the pants one. So it has indicators. So it's easy for us to know, when it's full and when it is time to change. So after this, then you can send the baby out, and that's a good routine in the daytime. In the nighttime, again, what we would prefer is oiling the baby if it is very dry. If the baby is fine, then just a regular bath. But 2 times bathing with moisturizer is very important. And next, coming to the diaper rash, like I was just talking about. So diaper rash is one of the very common thing that I see in my clinic. So what I would prefer is, like, every day you have to apply a zinc oxide cream before using the diaper. And then if at all there is prolonged time, if you don't change or you start on new foods, this is the time when the diaper rash is more common, like when there are antibiotics when we start. So in these conditions, when there's a diaper allergy, it's called nappy rash or diaper dermatitis, then we prefer zinc oxide, which is 40%. So this is what, when we do it, zinc oxide 40% is the ideal strength that we need to use when a patient has a diaper rash. But to prevent it, we use zinc oxide, which is between 13 to 15%. So that's about the diaper rash. And the next thing is the mosquito bites. The most common thing right now in this winter season. So for mosquito bites, first thing is prevention is the best. So I would always suggest to use a coil outside at the source of entry. So after that, next would be shielding your doors and all with a mosquito net. And the third thing was, even if you have to use a mosquito repellent, my sincere suggestion is use it before the baby comes into the room. And when the baby is coming into the room, turn it off, and then because there are still fumes, and it can cause rhinitis or allergies and all these things to the baby, which is not very good for the baby. So keep the door well ventilated and then let the baby come in. So this is how you can prevent it. Now, next is, suppose the baby already has a mosquito bite. So then what you have to do is, as soon as you have it, as soon as you have a mosquito bite, first thing you need to do is take ice, put ice compression. Because what happens is when you put ice, the baby's itching sensation comes down. The baby will not simply keep scratching it, right? So once you put the ice, let it settle down, and then first defense is apply a lactocalamine lotion like a Calosoft or something like that, and if to give that instant soothing effect. And after that, I would recommend wait for a couple of hours. If it's still not reduced, 90% it should subside with this. But there are a few babies, they are resistant to it. They have they're allergic. They overreact to a mosquito bite. So for them, what we do is we apply a over-the-counter hydrocortisone, like a QT soft or something, and leave it in the night time, so that there is, it heals faster and it doesn't leave marks. So another very frequent question I get in my OP is, after the mosquito bites, a lot of kids leave marks. So for that, what we do is we give a very simple vitamin C cream, which we just apply it over the mark, so that it lightens it naturally without going into steroids or any harsh chemicals. So vitamin C is a very potent skin lightening agent. So we generally just apply it on the marks only in the nighttime for like a week or 2 weeks, and then gradually it will come down. So that is about that's about the mosquito bites. And also another natural way to prevent mosquito bite, the CDC approved way is eucalyptus oil. Eucalyptus oil is a very natural remedy which you can just leave it. It is a mosquito repellent. So this is a very safe method instead of going for the fumes and of the vapors and all that. And also my personal experience, none of these have actually worked for my son. Where I stay, we have a lot of trees and all. So in such places, there's this product by Mama Earth, which is a mosquito vaporizer, which you can just spray it in the air. So that was one thing, it really worked for my son. And he's always with the stickers and all. So when you use these stickers also, never put it close to the mouth, where they can breathe it, like on the chest. Do not put in such areas. On the back, the correct place to put is on between the shoulder bone. And there you get two patches, right? So one for the back, one for the front. One is between the shoulder bone, and the second one is on his pants. So that way they will not be breathing those fumes. It is safe, and as well as it serves the purpose. So that is about the mosquito rash. And now coming to summers, how can we take care of our child in summers? So in summers, what we do is, instead of almond oil, instead of coconut oil, as I mentioned, we would prefer an almond oil. Use milder, like in the winters, we would use something very thick and greasy like Sebamed creams and all. Whereas in winters, I would use something thick like Sebamed cream. Versus in summers, I would use something like a Cetaphil, which is more thin. And I prefer always to have a separate shampoo and a separate body wash. So this is one thing that really helps. So I think I've covered most of the topics with baby skin, the routine, how you should, keep the skin damp. The most important thing when you apply moisturizer, always apply a daily defense diaper rash creams. So if there are any questions, I'm here to help you. Okay, so here are a few questions. My child is 4-year-old, he's suffering from scabies. What are the causes, and for this, how can you cure? So basically, scabies is a parasitic infection. So this generally transmits from person to person. So for this, we generally give a permethrin lotion, which you have to apply for the. It's something which will not go on its own. You will have to treat it. So for this, what we do is we give a permethrin lotion, which you have to apply from below your neck to the entire body of the baby in the night time. Next day morning, give him a wash, and the bed sheets, the clothes, whatever the linen, all of that, the linens and all of that, just wash it separately in warm water. And at the same time, if anybody else in the house also has itching or some scabies kind of infection, as I told you, it spreads person to person. So even if you treat your child, and if somebody in the house has it, there's always a chance that it comes back to the baby. So that is one thing. You'll have to use the permethrin lotion. You'll have to meet the dermatologist so that they explain you properly how to use it. Next question is so that is how to treat a baby with scabies. And the causes, as I told you, is a parasitic infection, transmits from person to person. So next question is, my child's skin is becoming too much dry. Any home remedies? So for the child's skin, as I just mentioned previously, give him a nice oil massage in the morning with coconut oil or almond oil, or if you can, do it alternatingly with these two. And after that, give a nice lukewarm water, quick bath, and then apply a nice amount of moisturizer on damp skin and make him wear, like, as you're saying, it's causing a lot of dry skin. You can make him wear like full covered clothes so that the moisture content is doesn't. You can make him wear full clothes. So these are the few home remedies. Give a nice oil massage. That's the most important thing. So is coconut oil good for massage? Yes, coconut oil is a very light-weighted oil, and it penetrates very well through the skin. So coconut oil is very good for massages. Okay, so next question. Also, skin rashes, even though okay. So the question is, डायपर रैश को नुकसान करता है, उसके करने चाहिए या नहीं, उसको यूज करना चाहिए नहीं. तो डायपर रैश के लिए what we ideally do is, as I told you, diaper, if you use it for prolonged period of time, it can cause rash. So the right way to prevent, as I told you, is apply a diaper rash cream 2 hours before the baby takes a bath. Keep him diaper free, give him diaper free time, like in the morning for 2 hours, evening for 2 hours, and then gradually try to increase the time so that way your baby is also potty trained. So you should not always cover your baby with the diapers. You should always give him a diaper free time. And also, apart from that, you should not, whenever you're starting on new food and all, you have to frequently keep checking whenever the baby has diarrhea, or when and frequent 2-3 hours, every 2 to 3 hours, you have to keep checking. So all these can help, preventing the diaper rash. So, and also don't use very tight fitting diapers. That's another very important thing. If you're using cloth diapers, make sure they're clean. And before you change the diapers, always wash your hands with a mild, with a mild cleanser, and then use it. Because a lot of times there might be so many things on our hands which we are touching their private area, which is already soaked in so much of, their urine and all. So it's always good to always wash our hands clean and then do the diaper changing. Okay, so the next question is, can you please help with tips for newborn skincare? So for the newborn, ideally, especially if your baby is newborn now, so what we have to do is, it's very important to wrap the baby in a lot of muslin cloths, so that the baby is kept warm. And because whenever in winter season, what happens is there is no humidity in the air. So because there is no humidity in the air, there is a lot of dryness that causes. So when you cover your baby in a nice muslin cloth, it helps to retain the humidity, and that way your baby's skin is more nourished and moisturized. There's more moisture content. And also always use baby products for a baby. Do not use adult products. What happens is I've seen a lot of people using adult products for babies, so which is not really recommended. You have to use a baby product because the pH is very different and it's a very sensitive skin. So use baby products. You give a bath twice if we are in India, because the amount, it's ideal. It's good to give a baby bath twice. Don't use steam or anything like that for the baby. It is not good. And also a lot of us put those tikas and all of those for the baby just for the evil eye. So that is also not good. And in case if you have to do it, because of our culture and all, I would always suggest it, please put it on the palm or on the foot on one leg today, and tomorrow shift it to the other leg. Don't put it in the same place continuously. Keep changing the place where you're putting the tika, the black, the evil eye dot. You have to keep changing the position. Don't put it in the same place, because that can cause dermatitis. It's called irritant contact dermatitis. And the baby will be suffering a lot. There'll be a lot of itching, redness, and it takes a lot of time. So it's a lot of trauma for the baby. So if you keep changing the position, if you can avoid it, best avoid it. But if you want to use it to outcast the evil eye and all, then keep changing it. Keep changing. Once right hand, then left hand, then right leg, then left leg. So keep changing wherever you keep putting it. Okay. So next question. How can I nourish my baby's skin? So the best way to nourish your baby's skin is by applying a good amount of moisturizer on damp skin. So this way, what happens is, the moisture, the moisturizer that you're applying is totally absorbed by the body. So that way, your baby's skin is well nourished. Or give a good oil massages, that all the oil gets penetrated into the skin. And also, most important, after the 6 months, once your baby starts sipping into water, always give good amount of water, because that will keep your the baby's skin hydrated. The chapped lips, it will help, and apply a good amount of lip balm. And every day give a head bath to the baby, because the baby's skin is so thin, and it attracts a lot of pollution. So it's good to give a head bath every day to the baby. Okay, so the next question is, which oil is best for massage in rainy season? So in rainy and winter season, ideally in India, from February, it starts becoming warm. So from February to August, it's good to use almond oil, because almond oil is slightly thicker. And in winters, from September to January, it's good to use coconut oil. So these two oils are the ones which we generally prefer. And for the hair also, you can use the same oil. Like for my son, I use Figaro olive oil. So olive oil is another very important thing that you can use. But one thing you have to take care when you're using olive oil is, you should make sure that when you apply olive oil, there are no scratches or anything, so that it's not applied on any abraded skin. So if your baby has any scratches or anything, it's best to avoid olive oil. But otherwise, olive oil is also a very good option. So in rainy season, probably you can skip between coconut oil and olive oil. My baby got rashes on bumps, red spot. What should I do? She's just 1 month old. I hardly use diapers. Otherwise, we use cotton langoti. So for the red spots, it's important to rule out the other conditions also. So the most basic and common cause could be when you're using the cotton langoti. As you know, a diaper can absorb water. A cotton langoti will not absorb water. So first thing is, it might be an irritation with the water, constant contact with the urine that is in touch with the baby. So and in case you have been avoiding diapers and also not using the cotton langoti and keeping the baby totally diaper free, the second thing is there could be some viral infection also. So it is always good to consult a doctor, because until unless we see what those red spots are, we will not be able to tell you. And another common thing could be mosquito bites. Even mosquito bites can leave red spots. So it's best to consult a doctor. Hello, doctor. Is it okay if I change the product of my baby? Of course, it's okay to change the product. In fact, what I have seen with my personal experience is never give the same product continuously. It's always good to change it. Like, for example, if you're using one product now, like once it's like suppose you're using a Cetaphil face wash, I mean a Cetaphil body wash for the baby. After 1 month, the Cetaphil baby wash will be finished. Then shift to something like a Sebamed. And then if that is also over, you can move shift to CeraVe. There's so many brands that are there. So it's always good to have 2 to 3 products. Try them out, whichever suits your baby, because not everybody is the same. So Cetaphil and Sebamed are two products which are good with most of the kids. So apart from that, it's always good to alternate them. Just don't use the same product, because a few things good in one, another might be good in another thing. So it's good to have all the ingredients. So you have to always keep changing the products. Hello, Dr. Navya. This is Reshma. I have twin boys. Which type of food I can give at evenings? Hi, Reshma. So it depends on the age of the kids. So if your kids are like newborn, like just after 6 months to 1 year, if they're infants, then it's always good to give boiled, purees, and mix a couple of vegetables and make it a puree and give it. And if the child is above 1 month, when they above 1 year and they're good to eat, then I think a full fruit is good instead of making it a puree, because they'll get used to the chewing, the taste buds and all, everything will be acquired. So if it's an infant, we generally prefer a puree. And if it's after a year, then it's good to have fruits and vegetables. So I would prefer only fruits or vegetables in the evening, and not any snack or fried item or anything like that. And makhana is also another good option if the baby is over 1 year. What routine should we do to keep skin moisturized for a 5-year-old? Okay, so for a 5-year-old, the baby is very active, plays a lot in the sun, and plays out in the sun, in the sand, and everything. So in the morning, it's good to after you're brushing your baby, give him a bath immediately, and then make him sit for a breakfast. The bath, as I told you, apply oil at least once a week for a 5-year-old, once a week or once in 2 weeks, but never stop applying oil. So a lot of us, what we do is once the child is 1.5 or 2 years, we stop applying oil altogether. So instead, make it a routine to apply oil at least once in 2 weeks to the child, and then give him a good bath, apply moisturizer. And for a 5-year-old who's more out in the sun and all, I would recommend a sunscreen also. So anybody above 1 year, I always recommend a sunscreen when you're stepping out. But for a 5-year-old, to a matter of fact, we know he'll be going out and playing. So apply a sunscreen, and then after he comes back, make sure that the child knows that he has to wash his face as soon as if he goes to school. For a 5-year-old, probably he'll come back home at 2 or 3. Once he comes back home, wash his hands, legs, and water with the plain water. And then after he's done with his lunch and sleeps and wakes up, give a fruit. And then again, he'll go out to play. And once he comes back, give him a bath in the night and then make him sleep. So I think this is the routine to keep your skin clean for a 5-year-old child. Don't forget your sunscreen. Don't forget the moisturizer. Give a 2 weeks once, give a nice oil massage to the child, so that his skin is more hydrated, and give a lot of water. And also a lot of times what happens is eating healthy food shows a lot of difference on the skin, keeps your skin healthy. So always give healthy food to the child. Make sure they get their vegetables and fruits intake rightly. Okay, I think we're done with most of the questions. Yeah, I think we're done with most of the questions here. So if there's anything, I'll always get back to you and I'll answer it. Okay, everybody. So thank you so much. Bye. Dr. Navya signing off.